BCEHS and paramedics in general have been responding to patients with palliative needs since BCEHS began. People have always called 911 in times of crises, especially when experiencing a crisis related to a palliative need.
If you arrive in a situation where you feel our scope can help a patient and they are palliative and their goals of care are to remain at home, call us. We will come, we will help.
I'm quite thankful that the nature of paramedicine and pre-hospital healthcare in general is evolving. It's moving away from simply a you call, we haul model to one that really puts the patient experience front and center. And it's about getting the right care to the right patient and directing them to the right further care.
Having conversations about serious illness is what we need to equip our healthcare providers to be able to do. So actually the conversations is the whole foundation of this. People think it's about the medication and the treatment. It is, but only if that's aligned with what you want.
My husband was in palliative care for lung cancer, and I had waited as long as I could, was told palliative care couldn't get there till 11 that day, and by 9 o'clock he was in dire straits, so I called.
A-STAR is assess, see, treat, and refer. You know, traditionally we would go in and transport that patient, but this gives us an opportunity to make sure that the patient is safe to stay at home as their wishes. There's certain guidelines that they need to meet, and then we consult with the palliative care team.
We were actually asked to go to this call on the advice and recommendation of one of our paramedic specialists in the Vancouver Dispatch Centre, who had flagged this call as one that might be requiring an advanced care scope. Part of what we do on our team is address palliative issues with a larger scope of interventions, some of which involve medications and others of which are non-pharmacological, but all within the context of supporting patients' own goals of care.
In our system, people are in community identified as palliative when they are expected to die within 6 months. But for many illnesses, we'll never know. What we will know is someone is frail enough to die, but we don't know when. So it's really important that people know that if the situation is they have a serious illness where death could happen because they are that ill, they should actually have a community team around them. Whether they're identified as qualify for those palliative services, they qualify for community services.
How are you doing today, John? Nothing much. You don't like getting poked, eh? Can I just do one poke?
Yeah.
Just one. If it doesn't work very good, then we'll just leave it. How's that? You get some of the elders that come in and they don't want to tell people that they're sick because they're stoic and it's kind of intrusive and they're not used to that kind of thing.
There was an equal emphasis about keeping the family in the loop rather than just going in there, treating the pain with the medications and the protocols that we've been taught. We let the patient and the family take initiative and in charge, and that was really special to get to see.
Having cared for my mom for 5 years, I have had many ambulance calls to the house, and they've usually resulted in them putting my mom on the bed and whisking her out to the nearest hospital, where we sit for several hours and wait. This time, 5 young people came in and completely took over my house. They were able to get my husband stabilized, get me calm, get him out of pain, and basically carry on their way.
Our main focus at that point was sort of an information gathering. So what exactly is going on? How can we best help? And also, what are the goals of care here? Basically, as soon as we started to explain to the patient and his wife that our main goal was actually to resolve and address his pain crisis, and that we had the ability, in our clinical opinion, to do that within their home, she was on board right away, and certainly the patient was as well.
The fact that their job was to get a patient stabilized and, I guess, triaged in situ made the world a difference. to us. It kept my husband calm. We knew he only had weeks left. It's gonna make me a bit sad, but this was one of the diamonds in the care that we had received, and they did a really good job, and they made things a lot better once they had activated the palliative care women who show up with boxes of medications and a mission. They were there the next day, and they didn't go home until we went back to hospital about 10 days later.
It was such a privilege to be part of it.